A man in Victoria has become the first Australian confirmed to have died from a Japanese encephalitis virus outbreak, as authorities across 4 states urge people to avoid mosquito bites to reduce their chance of being infected. There are currently 9 serious cases of Japanese encephalitis virus, JEV, in Australia, and health and agricultural authorities are working to contain its spread. Here's what we know about the spread of the virus so far. It's spreading to places where it wouldn't normally be. The virus has been present in parts of far northern Australia since the 1990s, including the Tiwi Islands and the top of Cape York in northern Australia, but the tropical disease has never been recorded in people further south. Now health authorities are trying to contain recent outbreaks in Queensland, New South Wales, Victoria, and South Australia, with cases confirmed in animals in at least 21 piggeries in all of those states. The highest number of confirmed cases in humans is in Victoria, with 7 infections picked up locally. In South Australia, authorities have confirmed 4 cases, with another 6 suspected infections, including one that led to the death of a man. All 10 people under investigation required hospitalization, with 7 people currently still in hospital, and 1 person sadly passing away, said Dr. Chris Leese, a well-being expert from the South Australian Department of Health. 2 cases have been detected in New South Wales and 1 in Queensland. Experts believe excessive rainfall, flooding and climate change have exacerbated the spread of the potentially deadly virus. University of Queensland virologist Jody Peters said weather conditions associated with La Niña had created excellent environmental conditions for the virus to thrive. It breeds up very, very rapidly during flooding events, she said. She said flooding in Australia's north had triggered the migration of birds further south, which were part of the cycle of Japanese encephalitis. Water birds in particular, they will become infected, they develop a lot of virus in their bloodstream and then they subsequently infect another mosquito, and that drives this transmission cycle, Dr. Peters said. She said infected pigs could also contribute to transmission. Pigs do develop enough virus in their bloodstream to infect another mosquito that comes and bites them, so clearly this is what has happened and why it's so rife in the pig farms. Dr. Peters said although experts had considered that JEV may spread further into Australia's mainland, the distance it had travelled without being detected was surprising. It is not spread human to human. Authorities say JEV cannot be spread from person to person. It is a mosquito-borne disease, and although people can catch it from mosquitoes, the insects can only pick the virus up from animals and birds. Dr. Peters said mosquitoes were not able to spread JEV by biting an infected person and spreading it to another. It can't be spread from person to person, she said. It has to be via mosquito bite, and humans don't develop a sufficient amount of virus in their system to infect another mosquito. The mosquito has to have picked it up either from a bird or from a pig. Victoria's Deputy Chief Health Officer, Deborah Friedman, said the fact JEV couldn't spread among people meant it would not lead to a pandemic. Because Japanese encephalitis is not transmitted from human to human, it doesn't have the capacity to cause a pandemic the way influenza or coronavirus can, she said. It's rare for infected people to become critically ill. Most people who contract JEV will have no, or only very mild, symptoms and fully recover. It is thought that only 20% of people with JEV go on to develop any symptoms, and only a very small number of them display significant symptoms.